Today we are going to talk about leukemia. It is a cancer of the blood and the bone marrow. It can produce an excessive amount of abnormal white blood cells anywhere in the body. The risk factors are smoking, such as cigarettes, can increase the acute of myelogenous leukemia. Family history. If one of your members have been diagnosed with leukemia, your risk will increase of having it. Exposed to chemicals. This can happen in certain chemicals such as benzene, which is found in gasoline and is used by the chemical industry. If exposed, your risk will increase of having different kind of leukemia. The first type of classification is by how fast leukemia progresses. Acute leukemia, the abnormal blood cells are immature blood cells. They can't carry out their normal function and they multiply rapidly, so the disease worsens quickly. The acute leukemia usually requires aggressive, timely, and treatment. The chronic leukemia, there are many types of chronic leukemia. Some produce many cells, some cause too few cells to be produced. Chronic leukemia involves more mature blood cells. These blood cells replicate or accumulate more slowly and can function normally for a period of time. The second type of classification is type of white blood cell affected. Lymphocytic leukemia affect the lymphoid cells, which form lymphoid or lymphatic tissues. Lymphatic tissues make up your immune system. Myelogenous leukemia, this type of leukemia affects the myeloid cells. Myeloid cells can give rise to red blood cells, white blood cells, and pellet-producing cells. There are 4 types of leukemia. One is acute lymphocytic leukemia. This most common type of cancer is in children. The second is acute myelogenous leukemia, mostly common in adults. The third is chronic lymphocytic leukemia. This may occur in adults, and these people with CLL can live a little longer without needing treatment. The chronic myelogenous leukemia, this leukemia is mainly affected adults if the person have few or more symptoms for months or years. The symptoms you can have is such as pale skin, fever, easy bruising and bleeding, tiny red spots in skins, bone or joint pain and tenderness, swollen lymph nodes, neck, underarm, groin or stomach, enlarged spleen or liver, frequent infections, weight loss, night sweats, shortness of breath. The leukemia, it can happen in the blood, the bones, the heart, the muscle, digestive system, and the immune system. The diagnosis can be physical exam, which would check up the pale skin from anemia, swelling of lymph nodes, enlargement of liver or spleen. The blood test, it can take sample of the blood to see if you have abnormal level red or white blood cells. And the bone marrow test, the procedure to remove sample of bone marrow from the hip bone, they use a long, thin needle. There are several treatments that they can do. Chemotherapy is one of the major forms of treatment for leukemia. This drug treatment uses chemical to kill leukemia cells. You may receive a single drug or a combination of drugs, just depending on what type of leukemia. Targeted therapy is also a drug treatment that focuses on specific abnormalities present with cancer cells. By blocking these abnormalities, targeted drug treatments can cause cancer cells to die. Radiation therapy. It is used X-rays or other high-energy beams to damage leukemia cells and stop their growth. Immunotherapy is used to immune system to fight cancer. Your body disease fighting immune system may not attack your cancer because the cancer cell produce proteins that help them hide from the immune system cells. Bone marrow transplant is a bone marrow transplant, also called a stem transplant, helps reestablish healthy stem cells by replacing unhealthy bone marrow with leukemia-free stem cell that will regenerate healthy bone marrow. During the process, you may receive a high dose of chemotherapy or radiation therapy to destroy your leukemia-producing bone marrow. Then you receive an infusion of blood forming the stem cell that can help rebuild your bone marrow. Infections and anemia are the major cause of death in leukemia patients. If the patient in his 70s decline the treatment, and they will only have life expectancy of 6 months or less. Over 400,000 people are living with or remission leukemia in the U.S. In 2021, 60,000 people are being expected to be diagnosed with leukemia. It is rare to get leukemia at young age, but still about 30% of children get some form of leukemia. Leukemia is mostly common at age 65 to 74 years old, more common in men than women, and mostly are Caucasian than African American. Down in the chart of 4 types of leukemia, we can see the 5-year relative survival rates overall. In 2021, the U.S. is expected to have over 24,000 deaths from leukemia. Back in 2013 through 2017, leukemia was the 6th most common cause of cancer deaths in males and 7th most common cause of cancer deaths in females in the U.S. Thanks for listening to the video.